Hi everyone, my name is Pratik Agarwal, and today we are going to learn on what basis do we select route of drug administration. What are the factors that we think of before selecting route of drug administration? So before we learn about that, we'll go through an overview on what are the routes of drug administration. One is enteral, right? Enteral, we can say through intestine. We can say that enteral means through intestine. So through intestine route of drug administration, which involves drug going through intestine, through liver, sorry, not intestine, going through liver. So that could be oral dosage forms and parenteral. Parenteral means passing through, not going through, passing through, not through intestine or liver, right? So we can uh, parenteral routes like intravenous, rectal, and many other dosage forms. We'll learn about those in the next lecture. But this time we are going to learn about factors based on which we select suitable route of drug administration. So there are around five to six factors. So first is extent of absorption of drug absorption. So the thing is, we'll compare here oral and IV. So what happens that when we give someone any drug through oral route, it gets disintegrated, gets mixed with the gastric contents, then gets absorbed, goes to metabolism, distributes to liver and other organs, get metabolized there, and some part of it remains, and most part of it gets excreted out without showing any effects to the body. So that is not showing 100% of drug availability, right? So what do we mean by drug extent of drug absorption? We mean that bioavailability, like how much bioavailable is the drug. We are asking about how much bioavailability or how much drug is at the end available for absorption. So in case of oral, because of lot of disintegration and dissolution, the drug is not getting available to the body parts fully. But in case of IV, as we are directly giving the drug in the veins to the bloodstream, so in that case, the drug is fully getting available to the absorption sites, to the site at which the drug needs to show its effect. So we can say that IV route is 100% bioavailable, whereas oral route is not 100% bioavailable. So it's very easy. When we think that the patient needs 100% of the drug, we choose IV route for drug administration. Simple. But when it is not so important to make 100% of the drug available to the site of action to the patient, then we can choose IV as well, or we can choose oral as well. When it becomes that not all the drug, it's important and not all the drug reaches the site of action, then we choose oral or other routes, which somehow reduces the availability of the drug that's reaching to the site of action, right? Now, second factor that influence like which route shall we take for drug absorption is condition of patient. So condition of patient, what do we mean by that? A patient is either conscious or unconscious. When a patient is conscious, he is in his senses, right? He is in senses and he can do voluntary actions like he can eat, he can drink, and perform activities. So when a patient is conscious, it doesn't matter whichever route we choose. Then we can, for example, go for bioavailability and decide if oral is needed or IV is needed or some other is needed. But when the patient is unconscious, that is when he or she is not in their senses, then the person cannot eat, cannot drink, and cannot perform activities. So in that sense, in that case, it is obvious the person will not be able to open his mouth. If even the person gets medicine in his mouth through stomach, he will not able to process it. He will not able to disintegrate it properly. He will not able to chew it properly. At the end, it all seems that patient will not be in the control of the activities that's happening to him. He will not tell you about side effects and all those things. Those are long story side effects and all. But at the end, oral route is not preferred when the patient is unconscious because we may not know if the patient has administered the drug properly. It might be like we have given him the medicine, the patient the medicine, but the patient has kept that medicine in the mouth. We don't know. It might cause obstruction in the pulmonary pipe. He might not able to breathe. There are a lot of misconceptions that can happen to an unconscious patient. So in that case, we choose a route which doesn't imply any patient activity or help during administration. That is IV route. Because in that we are directly injecting the blood to the system, and through involuntary muscle contractions and activities and flowability of the blood, the drug will show its actions to the patient. We will treat him or her. Apart from unconscious, we use we select this route of drug administration in case of patient is vomiting. Because what happens during vomiting, the patient will take the drug. As soon as it reaches, he might vomit and will vomit out the drug as well, which will not show any action. And we might not know that how much drug is absorbed in the patient, how much is in, if the effect is shown or not properly, and how much shall we give. So in vomiting as well, it is better that we provide an intravenous route or any other route apart from enteral route. Right? Another patient factor or another factor that influence that which kind of drug administration route shall we select is metabolism. So when we talk about body and metabolism, we have two options. Either the drug goes to first pass metabolism, or the drug bypasses the metabolism like a road. So this is a road which is going straight through liver to the site of action. And this is a bypass, which is also a road that is going, that's the same road that's going to the site of action, but it bypasses the liver. It bypasses the metabolism. Metabolism doesn't occur, directly affects the patient, which makes it 100% bioavailable as well. That's why it is bioavailable. So in biopress mechanism, we get IV route of drug administration. And that is why IV routes are 100% bioavailable because they skip the process of metabolism and the drug is fully available to the site of action to the patient. In first metabolism, same thing happens. Absorption occurs. Absorption then leads to distribution. Distribution then leads to metabolism, where first pass metabolism occurs and excretion. Now, in this part where metabolism occurs, an active drug can become inactive or less active, right? Less active, less active. And inactive drug can become active. Lipophilic drug can become hydrophilic, and hydrophilic drug can also become lipophilic. So all this can happen during metabolism. So all these things are bypassed when a drug is given through IV. But when we need first pass of metabolism, we prefer oral route. Now it includes that why are we taking, like, why are we metabolizing the drug? Why aren't we taking bypass metabolism always? The thing is, this question can be answered on the fourth factor, that is solubility. So a drug is either water soluble or lipid soluble, which we can say is either hydrophilic or is lipophilic. Now the thing is, let's talk about lipid soluble or lipophilic drugs. When a drug is lipophilic, it is able to absorb or gets transferred into the cell, into the tissues very easily. Why? Because organs are made of tissues. When lot of tissues combine, they make an organ. Tissues are made up of lot of cells. So at the end, we have to affect the cell of an organ, right? So to get into the cell, the drug needs to pass the cell membranes. And what are cell membranes made of? They are made up of lipid bilayer. So if a drug is lipid soluble, it's lipophilic, it will be soluble to the cell membrane as well. It will be cell permeable. And because it is lipid soluble, it is soluble in cell membrane and into the cell, showing its effect. So in this case, we don't need to worry if we go through which kind of drug we need to do, because lipid soluble drugs can directly apply to the cell, to the tissue, right? We do not need to convert the solubility of the drug because they can pass easily through the cells. So if we give IV or topical administration, the drug will easily pass through the cell membranes and will show its effect. That's why lipid soluble drugs are preferred in systemic circulation, right? So always lipid soluble drugs will be administered through route of will be administered through those route which involves direct systemic circulation, like IV, topical. And a water soluble drug will be soluble in water. Now, things which are soluble in water will not be soluble in lipids. Lipids are basically oils, you can say. We can say lipid as soil, oil. So, a water soluble drug will not be soluble in lipid, in oil. And if it's not soluble in lipid, then it will not be able to solubilize in cell membranes and go into the cell. So, we need to convert in a way that it becomes lipid soluble. So, that is why, for example, oral route of drug, water-soluble drugs or hydrophilic drugs are given through oral route. When given to oral route, it gets absorbed in the bloodstream, in the bloodstream. But when it gets to liver, it gets transformed to lipid soluble. When it gets transformed to lipid soluble, then then it's able to get into the cell membrane and into the cell to show its effect, right? So that is why first pass metabolism and bypass metabolism becomes a factor when we are giving a drug as well, right? That we need to crack the drug, or we don't need to crack the drug, we don't need to convert the drug. Now, if we go step ahead of this solubility thing, now, in this case, hydrophilic drug is converted into lipid soluble, and these are already lipid soluble. Now, the drug needs to be excreted, and lipid soluble drugs cannot be excreted. Hydrophilic drugs are able to excrete very well as compared to lipid soluble. So, the drugs are again transformed to hydrophilic so that they can be excreted. Right? So till now, we know that route depends on bioavailability, how much do we need the drug to be absorbed, condition of the patient as well, if it's conscious, unconscious, vomiting, metabolism, if we need first pass metabolism and bypass metabolism, which depends also on hydrophilicity or lipophilicity of drug. Now there is another factor which helps us to determine route of drug administration, that is rapid onset needed or not. This is also somehow related to patient only. Because when a patient comes to you and he says that, doctor, I am having head pain, your first question would be, is it severe or is it mild? You can tolerate it. The patient says, it is not so severe, I can tolerate it, but I fear it might get severe, it might get advanced, progress much more. So what you will give? You will give a drug which shows less onset of action, like takes more, has more duration for onset of action. For example, oral route. So because the patient is able to tolerate it, we'll give oral route because it will take time to show its effect. And the patient can tolerate around 30 minutes of pain So even if pain gets severe after 30 minutes, the drug would be showing its effect and the patient would not feel so much pain because the drug is now active at the moment. But for example, a patient comes, they say that doctor, it's quite a lot of pain all over the body and I cannot tolerate it. It's quite severe, never happened like that, all those things. So you need to give him rapid onset of action of painkiller. So you give him either IV or subcutaneous or etc. route. IV is 100% bioavailable and very fast acting. That's why we say rapid acting. In that case, we give him IV because he cannot tolerate. He needs emergency. It's an emergency. He needs emergent action. For example, when we give anesthetics, sometimes a doctor provides spray, sometimes the doctor provides IV injection. Depends on how long how long the patient can tolerate the effects, or how long the patient can tolerate the normal situation until unless he or she is anesthetized, right? So that's why rapid onset of action becomes a factor. Now the thing, now the next thing, the sixth factor, which influences our decision of choosing which route of administration should we take, is site of action. Let us again take pain as an example. For example, a patient comes, he says, I'm having pain in the legs, in the arms, in the head, all over the body. So it's a general pain all over the body. It's a general pain. It's a generalized pain. That means we need an effect that is generalized, that is in general to the body, not to a local person, to a generalized. So we need a generalized effect. How can a generalized effect all over the body be provided? If we give it IV, will go all over to the body because systemic circulation is there. Anything that is IV or systemic circulation. Another oral, because at the end, oral route is also going in your bloodstream, providing drug effects all over the body. It's just that we may need more effects, more oral dosages as compared to IV because of bioavailability, right? So oral. Another can be the patient comes and tell you, I'm really having pain in my hand. So that's a local effect that we need. So when a local effect is needed, what would be okay? Cream, that is topical application. Similarly, happens in case of fungus. A patient comes says, I have jock itch or I have tinea infection in the leg. Then we give clotrimazole or hydrocortisone cream so that they can apply it on the affected area, on the local area, external area, and treat it. That's a topical application. In the case of fungal infection has occurred in the stomach, you know, food poisoning or anything, then we give oral route. Sometimes IV route is also preferred depending on the severity and condition of the patient, if he is able to tolerate it or not, right? So that is how local effect or site of action depends. For example, you go outside, you play very well, and you got dirt all over your body. Then your mom will tell you to wash all your body, right? All the body. But if you go out and only your hands got dirty, you won't be then only wash your hands locally. Wash yourself locally on the hands only. Wash yourself in general. That is how these like site of action is a factor that influence our decision as well. And the last, we can say it is a factor. We can say it is not a factor. It's not quite important, but comes under a factor that is physical attributes or properties of drug. Whether the drug is solid, is liquid, or is gas. If a drug is solid, then it will take much more time to show its effect and would be less available to the body, right? Because it will disintegrate to solid, it will be a proper solid. It will first disintegrate in the stomach, then get soluble, then get absorbed and show by transform, then show its effect, right? So that would take a lot of time for the drug to show its effect. and would be less available, as we have seen. If the drug is a liquid, then the drug would be would not need not no- wouldn't need to be would need to be biotransformed, but would not need to be disintegrate in the body, in the stomach. It will not disintegrate. It will get solubilized in the gastric contents, then absorb if needed, will be biotransformed and then show its effect. So it would be much faster than solid form and would be more available because it didn't get disintegrated. So it got more absorbed and more less metabolized. More contents are available after getting biotransformed. If the drug is gaseous, so it will neither be disintegrated, neither it would be what we say soluble. It would get solubilized in gastric contents. Neither it would be absorbed. It will just be administered and it would get diffused. So diffusion is, for example, these diffusion is, for example, this is in cell. This is outside cell, right? Now there is a drug and there is no drug in the cell. So this is high concentration and this is low concentration. So the drug will move through the membranes to reach equilibrium state between inside and outside the cell until unless the drug is equally available on both the situation on both sides of the cell membrane. This is known as diffusion. So in gaseous state, the drug gets diffused. So it is more rapid acting because it doesn't have to go through such a long process. And secondly, it is more available because it's not biotransformed, it's not getting disintegrated and all those stuff. So in such case, bioavailability increases and time time of action decreases. So this is how we take. So solid drugs or tablet formulations or capsules take much more time to show its effect than liquid and gas, but is less available to the body as well. So these are the same factors that help us determine like what are the factors that helps us determine route of drug administration, extent of drug absorption, how much drug do we need. If 100% needed, we choose IV or systemic circulation, most prefer. If not 100% needed, then oral route is good. Then condition of the patient, if the patient is in their senses, then any route is preferred because they can choose any route. But if the patient is unconscious or is vomiting, then oral route is not preferred, whether it is liquid or gases or anything, oral route is not preferred. Only IV or systemic circulation is preferred. Then if the patient requires metabolism, yes, then oral route is preferred. If they don't require metabolism, then oral route is not preferred. Then if the product is lipid soluble, then then oral route should not be given. Any topical or IV systemic circulation route can be given because that will be directly affecting the cells and would be transferred in the cells easily. But if hydrophilic or water soluble drugs is there, then it needs to be first transferred into lipid soluble, which can only be done in the liver, which can only be done if the drug is distributed to liver, which can only be distributed if it's absorbed in a proper form, which is through gases, which is supposed to gastrointestinal part from the intestine. And at the end, the drugs needs to extract, so again need to be converted into hydrophilic state. Rapid onset of action, if fast action is needed, IV because not such a long route. We are bypassing the metabolism. So if you bypass the metabolism, we are saving a lot of time and the action is rapid. But if you're going through the metabolism part, then oral route is good and it will take a little bit of time to show its action. In site of action, we need all over the body or a particular part. That also depends topical or non-topical application and physical properties of the drug. If the drug is like what kind of drug is it? Is it liquid or like depends on the patient compliance also. Like physical properties of drug depends on the patient compliance. If the patient is compliant to take tablets or if he or she is compliant to take generally children are not so compliant with tablets, solid forms of drug. So they usually are given liquid form of drugs so that they are more able to take, more easily able to take the drug, and they so they aren't fussy about taking the drug. So this is how different factors make us determine what should be the route of drug administration in a patient. Next, we will exactly learn about what are the different type of drug administration and little bit knowledge about those routes of drug administration. Thank you and have a good night.